Welcome to Peconic Bay Medical Center. My name is Amy Loeb. I am the Executive Director here. As a result of a local farmer having a heart attack and the community coming together 70 years ago to create this hospital, it has become a regional medical center. It's really a wonderful story, and it continues to grow and blossom.
Peconic Bay Medical Center is located in Riverhead, Long Island. Coming out here, my eyes were definitely open to how diverse this community is.
Everyone is connected to this community. You feel like you're part of it immediately.
Since I've been here almost 11 years now, I've seen the changes. I've seen us keeping more of our patients out here.
Just being, a young doctor and being part of a place that has so much growth and still has so much more to expand to has been really great at this point.
The birth of graduate medical education at Peconic Bay actually happened in 2010. And then in 2016, our hospital became part of Northwell Health. And in 2019, we became accredited by the ACGME.
All of these changes to our program have allowed for tremendous growth. Our residents can now rotate across multiple hospitals and multiple urgent care facilities. Another asset to our program is Northwell's Center for Learning and Innovation, also known as CLI. It's a large facility that provides training for all of Northwell's employees. More specifically for our residents, it provides patient simulation labs and courses in business development. Another huge part of that is our bioskills facility, and this has procedural training courses for our residents. They cover our suturing, IUD placement, skin procedures, thoracentesis, paracentesis, and joint injections.
Welcome to the Corey Critical Care Pavilion. We are a level 3 trauma center. When we began the COVID crisis here at Peconic Bay, we literally had just opened this building, and we were able to care for those patients in our ICU, state-of-the-art, all negative pressure, and we were able to provide care that was truly patient-centered. This is a 60,000 square foot building, which was dedicated just in 2020. Our community stands behind this hospital with regard to philanthropy in a way that I've never seen in my career, and it's really very special. Everyone owns this hospital together. So we are going to walk into one of our 16 state-of-the-art, brand new ICU rooms. As you can see here, very spacious, each with a bathroom. Each room here is equipped with eICU technology, which means that there is a camera in each room connected to a virtual ICU within Northwell. We are able to tap into managing any kind of critical event that comes up 24/7. Each room has a place dedicated for families to be able to stay. Within the last few years, we began staffing with critical care physician's assistants around the clock here in the ICU, as well as surgical physician's assistants. Welcome to the third floor of the Corey Critical Care Pavilion, which is our Canis Regional Heart Center. This is the home of our brand new state-of-the-art cath labs, one of which is also equipped to electrophysiology.
We do have a helipad on the new Corey Critical Care Pavilion, and we can get them to the western part of Long Island in 15 minutes. We can get them to our sister hospital, Southside Hospital, in around 10 minutes. And then we do have ground ambulances.
Here we are in the trauma room of our emergency department. So it has already tripled in size over the last 15 years or so, and now we're looking to add another 20,000 square feet to the department. We see, believe it or not, 38,000 patients every year here in this department. So it's a busy emergency department. We service 400 square miles and 200,000 community members here at this hospital. So this emergency department is very important to this community.
Here I realized that there are so many people interested in research. I think clinical research helps move medicine forward. I have a strong interest in it. Peconic really, and the Northwell system was open to finding a place for me in the academic world. What made Peconic different is they never put me in a box or a bubble. They said I could try many different things while I'm here. They encourage that. It offers room for growth, opportunities, and everybody here is always open to exploring those with you.
I really guarantee a strong general medicine training. It's you and the attending together. And there's no fellows, there's no other co-residents you're competing with for procedures or for experience. You have the opportunity for a very personalized year in terms of your education.
Our program directors are very approachable. They have an open door policy, and I, as well as my fellow residents, feel very comfortable with going to our program directors to discuss any issues that might come up.
We have monthly program director meetings where we bring up concerns that we have, and all those concerns are always addressed in a timely fashion. We've been afforded the opportunity to have 4 wellness days in addition to our vacation time that we have. And you could use those wellness days at any point throughout the year for your own well-being.
We understand that they're people and life comes with hardships no matter what your profession is. We do whatever we can to accommodate their needs and make it so that they can tend to the needs of themselves and their families as well.
All the residents, the TYs, all 3 years of the family medicine program get along really, really well.
We're a very tight-knit group, and we do a lot of social events that help support that feeling. Some things that we've done in the past are apple picking, pumpkin carving. We also used to do, before the pandemic, dinner every Thursday night after medicine, and I look forward to doing that again. We're definitely a family in the hospital, and you get to know everyone that you work with very closely.
What helped us get through the pandemic was having each other and having each other to rely on, and having the support of the residents and also the attendings. And I think that's what makes this program so wonderful, and I love being part of it because we're all friends and we're all family.
10 years ago, when I rotated as a medical student, experience was very personalized. It was one-on-one with the attending, where I got to pick the mind of the attending and ask any question on any aspect of patient care. That culture is still a huge priority for us, is to personalize education and still have that one-on-one mentor relationship between the resident and the attending physician.
I definitely have a sense of pride being part of Peconic Bay Medical Center Residency. It's been a great experience since I've been here, and just to know all the resources and opportunities that I have moving forward.
I feel very strongly that a graduate from our transitional year residency can be hand in hand with a graduate anywhere in the whole country with regard to knowledge and experience.
Thank you for taking the tour of Peconic Bay Medical Center with us today. We can't wait to meet you. And the real question is, are you made for this?